Are you a clinician looking to learn how to provide ultrasound-guided procedures for your patients, but you were never formally trained? Are you a training institution looking to increase the amount of hands-on time with needles a student gets prior to the first day in clinicals? Is July closer than you initially thought? If this sounds familiar, then Ultrasound Red Goo Phantoms are for you. Ultrasound Red Goo makes ultrasound phantoms. Phantoms are medical models or simulators that allow clinicians to view mimicked internal structures with the ultrasound machine and place a needle into it. Our phantoms are simulators that provide clinicians and students with the target they require to adjust the controls of the ultrasound machine to optimize the image. Now, we refer to this as knobology. Learners can run through the scanning of structures and keep them in view while moving the probe. And most importantly, they can practice needle contact and needle approximation skills. Some phantoms are high fidelity and resemble one instance of human anatomy. These phantoms often cost between $5,000 and $10,000 and do not allow the provider to gain very much experience with multiple instances of human anatomy. Ultrasound Red Goo makes low-fidelity phantoms that offer a reasonable alternative to these expensive products and still allow the clinician to gain the skill they need to become ultrasound proceduralists and one day experts. Low-fidelity phantoms have demonstrated similar educational benefits when compared to high-fidelity phantoms. Now, you can ask me about that. Our phantoms contain simulated vessels and nerves, and once you become accustomed to contacting or approximating these structures, the skill you gain will translate into more successful line placements, nerve blocks, and fascial plane blocks. To be effective, phantoms should be easy to use. The target should be simple to set up, small enough to facilitate easy storage, and budget responsible. Perhaps you will be keeping this phantom in your office or your house, much like I do. This is where the Red Goo Ultrasound Phantom targets come in. The Ultrasound Red Goo Basic Trainer has one small vessel that simulates an artery and one large vessel that simulates a vein. It also includes a hyperechoic or white structure that mimics a nerve at the terminal branches. The basic phantom is compact and can withstand hundreds of approximation attempts. This phantom will scan well with any ultrasound machine. Our current phantom is the result of over a decade of producing ultrasound phantoms with the support of our clinical, scientific, and industry supporters. This work has resulted in a long-lasting, durable phantom. Now, let's take a look at what this phantom can do for you using the basic phantom. In the center of my screen, where I get to the very middle. Practicing image optimization, scanning, and needle contact and approximation on an Ultrasound Red Goo Phantom target will give you, as a clinician, the confidence and ability you demand to provide your patients with the precise ultrasound-guided procedures they require. Get yours today at www.ultrasoundredgoo.com.